the home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuga Online, your inspiration radio station.
Hello, welcome to another episode of Healthcare Hour with Colleen Qvist. You, I'm sure, have had an awesome week, and I know that there's strange weather patterns all over the world, so hopefully that you are well wherever you are. As you know, Healthcare Hour is all about healthcare. It's about healthcare professionals. It's about us understanding that they are people and they get tired and hungry. It's also about us knowing that as patients, we need to improve the relationship between the healthcare professional and the patient and the patient's family. And also for us as patients, because we are all patients at some point, for us to improve our understanding of our own health and to know that we are experts in what's happening in our own bodies. And of course, we look at different aspects of healthcare. So we also see, for instance, that you get entrepreneurs in healthcare. And today, after the break, you're going to be meeting one of them. Yes, it's quite exciting. So let's go for that break.
The home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
Countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuga Online, your inspiration radio station.
Welcome back. You are tuned to Healthcare Hour with Colleen Qvist. Thank you for listening. Thank you for all your messages in the week and for your contribution to the shows. Let me introduce you to our guest today. His name is Tshepo Raofa, and he is joining us from Limpopo. Hi, Tshepo.
Hi, Colleen. Thank you, and good day to the listeners, and thank you for having me. I'm so excited to join the show.
Awesome. So you'll see we can't see a picture of Tshepo, so you'll just have to see one picture of him. But we are having technology problems at the moment. I think probably because you're all the way in Limpopo. And but we are making a plan. So yes, could you tell the listeners a bit more about yourself, Tshepo, from a point of view of, like I know you set off to study engineering in the beginning, and then you took a left and off you went somewhere else.
Yeah, thank you. So, I grew up in Limpopo, right? Deep rural, the place called Mawa. It's Mawa Blockade. That's where I was born and brought up. I attended primary school here, and secondary school is also around the same area, but the high school is called Kisatwani High School. I matriculated in 1995, and then I went on to enroll for engineering studies with Jamestown College. I think now they are TVETs. Yeah, something like, but I was doing engineering studies, mechanical engineering studies, and I completed my N6 from there, and I think it wasn't easy having both parents unemployed. I was just trying to navigate my way around in terms of career path, what is it that I really want to do. For me, in the healthcare, it has been more of a calling than a career per se, if I may put it that way, because I didn't want to have a career in the healthcare system. I always wanted to do something with engineering, but after completion, and we like when I was maybe visiting different workshops around engineering experiments, there would be incidences where everybody would run away, and I'll go and try and assist to whoever is injured or something like that. So that's when everybody started pushing me and encouraging me to say, we think you are in the wrong field. And at some point, I had to admit and say, let me do how I'm being advised and follow what people see in me. That's how I ended up taking a short left and changing a career, which wasn't that easy, because I was already in love with the engineering profession. So fast forward from that, that's when I joined. I enrolled for nursing studies with Alaska Nursing College. It's based in Helen Joseph Hospital. I joined in 2005. I was doing my practicals based in Tembisa Hospital. It was a 4-year course. I graduated in 2008 with a 4-year diploma in nursing, which inclusive. It has general nursing. It has got psychiatry, community, and midwifery. But in the context of me being a male, then that would be an aquature. And then after the service in Tembisa Hospital, I was based in casualty department from 2009, then 2010. In 2011, I left the hospital. Actually, I was relocating back to Limpopo, and then I came back home. I worked in a clinic, primary health care clinic called Ramatsinyali Clinic. It's based in Ramatsinyali village. It's not far from where I grew up. And then I worked there from 2011 up until 2013, when I now had to go and join. I joined Anova Health Institute as a nurse mentor stroke trainer. Then we were doing health for men programs, and because I was the only nurse mentor based in Limpopo, it was more of a pilot for me. I was tasked to train and mentor nurses in Mopani and Vembe primary healthcare facilities. Of course, I was not alone. I had other trainers that I don't know whether you would want me to mention their names or not, but we were a team. It's just that I was the one who was based in Limpopo, because after doing the training, then it was sessions which I had to run the primary healthcare facilities and mentor the nurses until such stage where we will now deem a facility competent. I think by then they needed to have at least 75% of the personnel trained on the MSN program. After that, I think I spent most of my time with Anova, because I would say I worked with them for over 10 years. And then in that journey, I worked as a nurse mentor for Health for Men project. And then I switched within Anova to other health system strengthening programs. still as the nurse mentor, but now I was based in the Greater Tzaneen sub-district here in Mopani. And in 2017, I was promoted to a sub-district coordinator within Greater Tzaneen sub-district, still with ANOVA, up until 2020, when I was also promoted to a sub-district manager position, still within the Greater Tzaneen sub-district under ANOVA. And after I left ANOVA in 2024, that was last year, to join VETS RHI as a program manager for key populations programs. Up until we were unfortunately retrenched when the funding was cut or ended from the USAID with the American government. In terms of with my studies, I think I left it where I indicated that I enrolled for nursing with Alaska, and then in 2012 I enrolled for primary health care diploma as a postgraduate diploma with the University of Limpopo here in Tshepo. And I completed that record time, and after that, currently, okay, after that, I think in 2023, I was fortunate to be selected amongst future leaders, and from ANOVA, we were enrolled, or I was enrolled with the first business school for management development certificates training, which I also completed successfully. I think one of our group was one of the best. We even won an award around that. It just excites me to talk about the business school. I really had that one. I think that's where I met Coach Colleen. That's where I met Coach Colleen for the first time. And then from there, we also graduated, got our certificate, and I'm currently enrolled with the Professional for Health Development, that is FPD, or Masters in Public Health. Yes. And then everything, okay.
Yeah. So very exciting. I can see, that you have spent your whole adult life improving your education, finding out more, doing more qualifications. So you do epitomize lifelong learning. Yeah.
Come again.
I was just saying that we can see that you are learning. You're doing lifelong learning.
Learning, I don't think I'm gonna stop.
No.
It's just the challenges of learning while you are trying to create a balance between being a family man and being a father, being a husband, and also doing your job where you're employed. Yes. It's a bit challenging, but learning, I don't think I'm gonna stop.
Okay.
I'll
All right, so let's go for an advert break, and then when we come back, we're going to hear about your venture that you're busy with now. But let's go for a break.
How do you know the life of personal coach you're about to work with is who they say they are? How do you know if they can do the job? At the Africa Board for Coaching, Consulting and Coaching Psychology, we can tell you. So, before you share your secrets and spend your money, check with us first. Visit www.abccccp.com or call us on 012-751-7608. The ABCCP, the professional body for coaches.
Welcome back. You're listening to Healthcare Hour with Colleen Qvist. My guest today is Tshepo Raofa, and he is joining us as an entrepreneur now in business. We've been speaking about his background. He's grown up in Limpopo. He's given lots back to Limpopo. He started off in engineering, and then he went veering off into nursing. And from there, he's also, advanced his career. But what often happens as well is we hear about the funding that was cancelled, okay, and we often think it's just like out there, but that has obviously directly impacted Tshepo in that he was retrenched from his job, and so then it was okay. What's the next plan? So before you go into your plan, how have you been impacted by being retrenched?
Yeah, yeah.
Difficult questions, hey?
Yeah, it hasn't been easy. Hey. Unfortunately, when you are in a managerial position, you still carry the burden wherever you go. Currently, when people are struggling with other things people that whom I used to manage, they still reach out to say, hey, we are I'm having challenges with this and that and that. And it's like that responsibility, it's following you. I just to off ramp a little bit, the last time when I went to the Department of Labor to put in the application for the unemployed insurance fund, I met quite a few people there whom I used to work with. They were my subordinates, and some of them they were like asking me then how can you be assisted here? I was like, guys, I'm also in the same position as you. I also need to be assisted here. Unfortunately, those are some of the frustrations that you go through. Yeah, so back to the question.
Yeah, plan B.
It's not. It has obviously financially impacted me badly, and personally, I had to adjust from getting a salary on a monthly basis to zero, which is what the circumstances currently. And unfortunately, it's the things that you never really plan for. You can have maybe backup plan or plan B in life, but as and when it happens, especially this one, because it just happened just like that, without giving us enough notice.
Yes.
It really impacted us very bad. It is very bad, I can tell. And also at home, you have to also do now adjust the lifestyle. Now people need to now try and understand that you're no longer working. The kids now they were not really used to seeing you around full time, but now they start seeing you here full time. Yeah, it's really not. I don't know how to explain it, but it's a huge adjustment if I may put it that way. And also now, obviously, you would have people trying to also guide and assist you, and it's more of them sharing information when they see there are other opportunities out there for you to get employed. And it's frustrating because when you now, especially that I worked for quite some time in managerial positions, when you start now seeing the salary adjustment that you need now to do, it's really not that practical.
Yes.
It's a huge psychological switch, if I may summarize it that way.
Yeah. And then, of course, now as well, I mean, we do feel for you. We empathize for what you're going through. And it's also, we're also recognizing the fact that, part of you feels like, oh, we'll just give up now. but you are finding a different way. And it is about looking for the blessing in what you're going through, like maybe being able to spend more time with your children.
Yes. Yeah, I think now, obviously, one has to look for the positives in every situation. So currently, yes, it's a situation where I'm like, okay, given the period or whatever I'm going through now, maybe it's time for me to try and spend more time at home with my kids and my wife. Um, yeah, which, by the way, they are very supportive. I want to thank them. And so far, my wife has been very, very, very supportive and understanding. And yeah, even when I started now sharing the new vision that I'm carrying, um, she has been one person who's been behind it to say, I believe in you. You've got my support in whatever you want to venture into. Even if you want to, maybe at some stage you want to consider going back to be employed somewhere, you still have my support.
Yes.
But full time now, I want to support this vision that you are carrying currently.
Okay. All right. So, yes, let's recognize her. Let's recognize your children. Let's recognize all the partners out there who stand by, their loved ones and seeing, okay, sometimes one chapter closes and another chapter opens. So, talk to us about the chapter that you are opening at the moment.
Okay. I have founded a health and wellness clinic, but it wasn't an easy one also to even come up with the name. But we ended up naming it under our surname to say it's Raofa and Health Wellness Clinic, because we looked at different names and how they can relate to us and the likes, but I think at the moment we thought this one would be a better name for the facility. So me being the founder and myself and my wife being the founders, but for her, she's playing more of a supportive role because she's still employed somewhere. So we didn't want to create a conflict of interest situation, kind of. So I'm the one who's full-time volunteering in the organization or in the facility. I've got one, we have got one clinic assistant, but he's also being trained. I think there's a distant sound. I'm not sure if it's from my side or from your side.
Okay, no, can't turn it down, but we're managing, yes.
Yes, there's one clinic assistant that we are busy training, and I must say I'm also humbled by him allowing to join us and be trained, because we don't necessarily have an income. So for a person to really give their time to say, I'm willing to learn, I'm willing to be taught, whether there is a salary or not. I think that needs to be recognized as well. So even myself, I would say I'm volunteering because I also don't have an income.
Yes.
We just founded the clinic with a new, I would say a new package, healthcare service package, not necessarily new, but it's something that it was never done anywhere before. I haven't seen it anywhere before. It's only an innovation that we thought it will, I don't know how to put it will easy or create more access to healthcare services to our community.
Yes.
Because most of the, or I would say what pushed the whole vision was identifying gaps that are there in our healthcare system, especially in the rural settings where we've got a lot of, I would say, transport issues. When people are supposed now to move from home to access healthcare, even though with our DOH primary healthcare facilities, the services are for free, but people still need to travel. And when they need maybe a different level of healthcare services, they would then now have to travel and still go and pay for the services with other service providers.
Yes. Okay, so we're going to hear more about that after the break. Let's go for a break, and then we can dive into more about what you're offering and, of course, how you've closed that gap. Let's go for a break.
The Africa Center for Work-Based Learning is a professional development center for professionals who aim to improve their professional standing. This means that the learning programs we run are more than just academic programs. They are work-based programs that focus on leveraging your current experience as a professional to build your overall profile. A year down the line, the Africa Center for Work-Based Learning is developing into a preferred center for professional development in Pretoria, with 8 professional development faculties including accounting, teaching, entrepreneurship, as well as IT and many more. For more information, go to acwbl.org or dial +27 12 751 7608. The Africa Center for Work-Based Learning, where work is learning.
Welcome back. You're listening to Healthcare Hour with Colleen Qvist. My guest today is Tshepo Raofa, and he has been talking to us about identifying a gap in the rural Limpopo where he lives and seeing how, although clinic services are free, the patient has to be able to get to the clinic. And that's where transport comes in, that's where costs are involved, where they don't necessarily have access. And so, it's about improving access to healthcare. So with your clinic services, Tshepo, you are now saying that you are taking the services to the patient. Okay, and what kind of services are you taking to the patient?
It's at primary healthcare level, but normally what happens, we are not that well known, but
I got to see your adverts.
Yes.
Yes.
Yeah, so we've been trying. Hello, are you still there?
I'm there, yes. You've been trying to?
Yeah, so it has been more of phase 1 of of rolling out the services. Phase 1 has been more of the marketing stage, if I may put it that way. So we thought for the first quarter, let's concentrate more on marketing.
Mm-hmm.
And that's what we've been doing a lot now, because we only started in May.
Yes.
That was last month, yes. Yes, so it has been more of that. And then I must say, I'm also thankful to the response that I'm getting. It has been more of people calling in and asking for clarity. What is it that you are doing? Because we have never seen this. We don't really understand what is it that you're doing. So I've been trying to answer as many questions as possible and try and clarify. And people are really, really, really appreciating it. And fortunately, we have started seeing patients. The aim was to start seeing patients after the first quarter. As I said, the first quarter has been more of marketing. So we haven't even, we're in the second month of phase one or of the first quarter, but already we are seeing good response from the community. What usually happens, they would call and I'll do a telephonic consultation before we go out, because we haven't really, even now we haven't really, we were working on a space where we are supposed to work, which is a rental space. There was an agreement. Unfortunately, there were hiccups in terms of us moving in and starting working there. So, but we are also trying to work out something now. I think we might end up getting a permanent space where we will be based and do or allow walk-ins as well. So currently, what they'll do, it will be telephonic, and then I am from that telephonic consultation, then it will now give us an idea of what is it that we are dealing with. And then we I don't know whether should I say pre-pack whatever we need to go and use when we visit the patient at the household, and so that we go there having the relevant things, and because some of the basic medications. Remember, with medication you also need to adhere to certain monitoring systems.
Yes.
There are medications that there are fridge items, there are medications that ideal medication is supposed to be in a temperature-regulated area. So we have sacrificed here and converted a room into a pharmacy where we made sure that it meets all the standards. There are aircons, there are fridges, it's locked. All those regulations, people who work in the healthcare systems don't know what is that is needed for one to store medication. So we have done that. So after the telephonic consultation, and then now we prepare what will be needed when we go and see the patient. Possibly what will be needed. I don't think it's going to be everything, but we now have an idea of what is it that will be needed when we do the consultation or when we do the house visit, and then we dispense a car. We go and visit the patient at home, and I think, like I highlighted, when you visit someone at home, for me it's a plus because now other psychological things and the psychosocial factors that come into one coming up with a management, a holistic management approach towards the patient. It's now you see the reality of what is household. You cannot be now expecting a person to say, talk about fridge items, for example. Then when you reach the household, then you realize there's no fridge.
Yes.
So those are the realities that I encounter. At times you visit a household where you find a bedridden patient, then you are like, you can see how much you've saved in terms of that patient, maybe arranging transport to transport him or her to the nearest facility. So that's where those are the gaps that I was identifying throughout my years of experience in the healthcare system, especially in the primary healthcare setting. So those are the things that I was identifying, and I would say you would see how people struggle with bedridden patients, and then when you see a bedridden patient in a facility, you don't necessarily have an idea of what is going on in the household. And then you start seeing your pressure sores, you start seeing your bed sores and the likes. But when you visit home, now you start seeing the reality of what is it that is going on. Where is this person sleeping? What is it that now is leading to this pressure sores and the bed sores and the likes? So those are I think it becomes more you can now easily relate with the patient and try and come up with a management, I would say a management plan that will specifically be accustomed to that client, given what you are seeing at home.
Yeah. And so a much more holistic approach, and obviously realistic, in that you're not going to come up with, sometimes we can have a plan that's like for somebody who lives in Sandton, not for somebody who lives in a rural area.
Definitely. When you visit the household, you really need to hold back your tears. The things that you will come across with certain clients, when immediately before you enter, they open the house for you. You can just some of the not so nice smell. You already it can tell what is it that you are getting yourself into.
Yes.
Also, remember, when a person visits you in a facility, you would have somebody who's already on treatment or already taken some sort of treatment for the symptoms, or for the symptoms that they had, or it's either they are even chronic.
Yeah.
So most of the time you find that it delays the management of the patient, or it restricts you in terms of giving treatment, because you're not sure what is it that they left at home to avoid things like your overdosing and the likes. So when you are there, and when a person says I'm a chronic, or they gave me 1, 2, 3 when I visited facility A, then you are able to say, let me see. Then you are able to now plan around and say, okay, this will be my plan in terms of the treatment that I'm supposed to give the patient, because I can see what the patient is already on, or what the patient is already failing on. And I think it's really too holistic, and it's not the way I imagined it initially. But as I'm going into the households, those are things that now I'm starting to see them having more of positive impacts than I thought.
Yes. Okay, Tshepo, so we have reached the end of our show, but well done to you for actually recognizing the gap and for doing something to close the gap so that people have equal access to healthcare.
Yes, thank you. I always call you Coach Colleen. That's how I stole your number from the business.
Coach Colleen, yes.
We attended. Yeah, so thank you very much for really having me and taking this opportunity to understand what is it that is being done from this side. It's a new innovation. I'm happy that people are supporting it. Special thanks I want to dedicate to my wife, the Dr. Safatsa. Is one person who has been encouraging me to start the practice, but I was hesitant. And even now, when I went back to him and say, I think now I've reached a point where now I need to implement what you've been telling me. He was like, I told you, I don't know what is it that you were waiting for. He's one person who's been very supportive. And when we are doing the consultations as well, he's able to also step in. I think it also minimizes referrals as well, because there are cases where you would see this is a case that now I need to refer to another level of care, especially a doctor level of care. He offered and allows me to call him, and then we do visual consultations so that he can see exactly what is it that I want to refer, and he's able to step in there and say, with that one, I think, or let's decide. I'll write you a prescription. I think this is the way we can manage it better to minimize having the client now having to go to a doctor maybe in the next day or something like that. So I think I'm really grateful for his support as well.
Okay, so thank you very much. Thank you for being my guest. It seems to have gone by very quickly. But yes, wishing you all the best, and knowing as well, like, people will look you up on social media and be able to use your services.
Yes, thank you you very much. I'm also hoping we're gonna have round 2 as the phases unfold, just to give to also have progress, and we'll be also adding some of the services, because some of the things now, as I'm doing with the house calls, we are not able to do. You know that there are restrictions in terms of sterility and other things. So we are not currently offering some of the things, but as we grow and have a stable place, then we will start offering more and more services. So hopefully we'll come back and update the community at large. Thank you very much.
Thank you. All right, so you've been listening to Healthcare Hour with Colleen Qvist. Thanks so much for all your contributions. Please remember that you are loved, you matter, and you're not alone. And we'll see you all next week.
The home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
Countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuga Online, your inspiration radio station.